Hi everyone. I'm Dr. Shin-Young Yim, the Center for Torticollis, Jeju University Hospital, South Korea. Today, I will tell you about a rare disease called Beckwith-Wiedemann syndrome. Beckwith-Wiedemann syndrome is among the differential diagnoses if your newborn baby weighs quite a lot with a large tongue, umbilical hernia, and low blood sugar. What is Beckwith-Wiedemann syndrome? In video 121, I talked about Soto's syndrome, another disease with overgrowth. Beckwith-Wiedemann syndrome, BWS, is also an overgrowth syndrome. The affected infants are larger than usual, called macrosomia. Some may be taller than their peers during childhood. In some children with Beckwith-Wiedemann syndrome, specific body parts may grow abnormally large on one side of the body. It leads to an asymmetric or uneven appearance. This unusual growth pattern is called hemihyperplasia. Their tongue is almost always larger than average, with the tongue out of the mouth. This is one of the cardinal signs of BSW. Overgrowth occurs not only in the birth weight but also in the internal organs such liver, kidney, and adrenal gland. The internal organs may be larger, called visceromegaly. The infant's intestines, liver, or other organs may stick outside of the belly through the belly button. The affected infants may have the umbilical hernia shown in this picture. Others may have omphalocele. To differentiate, an umbilical hernia is entirely covered by skin, unlike an omphalocele. Omphalocele, also known as exomphalus, is a birth defect of the abdominal wall. The organs are covered in a thin, nearly transparent sac that is hardly ever open or broken. Sometimes overgrowth ends up with unusual growth of certain cells, which increases cancer risk. This unusual growth pattern usually becomes less apparent over time. Ear creases or pits and nevus flammeus on the forehead also are characteristic features of Beckwith-Wiedemann syndrome. The genetic causes of Beckwith-Wiedemann syndrome are complex. The condition usually results from the abnormal regulation of genes in a particular region of the short arm of chromosome 11 called 11p15.5. Beckwith-Wiedemann syndrome was first reported by Dr. Bruce Beckwith, USA, in 1963 and Dr. Hans Rudolf Wiedemann, Germany, in 1964. Dr. Beckwith was a pathologist, and Dr. Wiedemann was a pediatrician. Symptoms and signs of Beckwith-Wiedemann syndrome. Beckwith-Wiedemann syndrome is a condition that affects many parts of the body. Beckwith-Wiedemann syndrome is a growth disorder characterized by macroglossia, macrosomia, hemihyperplasia, omphalocele, ear creases pits, and nevus flammeus on the forehead. Macroglossia and macrosomia are generally present at birth but may have a postnatal onset. Beckwith-Wiedemann syndrome is also frequently accompanied by neonatal low blood sugar and too much insulin, called hypoglycemia and hyperinsulinemia, respectively. Beckwith-Wiedemann syndrome also has large visceral organs, renal abnormalities, and adrenocortical cytomegaly. Beckwith-Wiedemann syndrome is known with an increased risk of some embryonal tumors, such as Wilms tumor, hepatoblastoma, neuroblastoma, and rhabdomyosarcoma. Embryonal tumors are tumors that start in the fetal embryonic cells. Embryonal tumors can occur at any age but most often occur in babies and young children. In summary, Beckwith-Wiedemann syndrome has some of the symptoms, such as overgrowth of weight, height, and internal organs, enlarged tongue, abdominal abnormalities, low blood sugar, too much insulin, and increased cancer risk. This slide shows an abnormality called adrenal cytomegaly. That is an example of organ overgrowth. Overgrowth begins to slow by about age 8, and adults with this condition are not unusually tall. This slide shows the cardinal features of Beckwith-Wiedemann syndrome. Large tongue, omphalocele, hemihyperplasia, also called lateralized overgrowth, too much insulin, and characteristic pathology findings such as adrenal cytomegaly. The suggestive features of Beckwith-Wiedemann syndrome are heavy birth weight, nevus flammeus of the forehead, ear creases pits, embryonic tumors, large kidneys, oversized liver, and umbilical hernia. Prevalence of Beckwith-Wiedemann syndrome. Beckwith-Wiedemann syndrome is a rare disease with an estimated incidence of 1 in 13,700. The condition may be more common than this estimate because some people with mild symptoms are never diagnosed. Today, I talked about a rare disease called Beckwith-Wiedemann syndrome. I went over the symptoms and signs and prevalence. Thank you for watching this video. See you next time.